People are talking about PrEP.
People are talking about PrEP.
People are talking about PrEP.
But what is it?
But what is it?
What is it and what does it do?
What is it? What does it do?
PrEP stands for pre-exposure prophylaxis. Pre means before, exposure means in contact with HIV, prophylaxis means prevention. PrEP is the use of antiretroviral medications to prevent someone who is not infected with HIV from getting infected.
There are lots of ways to help reduce your chances of becoming infected with HIV. Using a condom correctly and consistently has been the main strategy for years.
Other ways to prevent infection are delaying your sexual debut, reducing the numbers of your sexual partners, male circumcision, and abstinence.
PrEP is a new additional HIV prevention strategy that reduces your chances of becoming infected with HIV.
Did you know that in Swaziland, 1 out of 4 adults is living with HIV? Every year, around 7,000 people are newly infected with HIV.
Most of the new infections occur in young people between the ages of 16 and 25. Not everybody is aware they are infected with HIV. Therefore will not get treated and can unknowingly pass the virus to others. The only way to know if you are infected is to get tested.
PrEP is a game changer. PrEP provides a way to empower people like you and me to take control of our health while dramatically reducing our risk for getting HIV.
Taking 1 pill a day, every day, is the key to PrEP.
Remember, PrEP needs to be used daily in order to work. If you miss doses, it may not work well.
What you need to know about PrEP.
First, the good stuff. PrEP is very safe and more than 90% effective at preventing HIV if taken every day. It is safe and effective to take with all types of contraception. It is a private method that you can control. It is safe to use while pregnant and breastfeeding. It's a way to decrease your fear of getting HIV. And now, the annoying stuff. Some people may experience mild effects like headaches and nausea. Most side effects go away in a couple of weeks. PrEP does not prevent pregnancy or other STIs. Other stuff you need to know about PrEP. It may not have to be used forever. PrEP can be used as long as you feel you are at risk of getting HIV. PrEP is not a cure for HIV.
PrEP should only be used if you are HIV negative. HIV positive people need a different combination of ARV drugs than those for PrEP. That is why anyone who is starting PrEP needs to have an HIV test first to make sure they are not already infected with HIV.
You will need to be tested regularly as long as you are taking PrEP. PrEP is safe and it works very well, but it needs to be taken daily. So, what will happen if I want to start PrEP?
You will need to tell a healthcare worker if you are interested in starting PrEP. We will then do a risk assessment to identify your risk for HIV. If you are at risk and you are interested in starting PrEP, we will do some counseling on PrEP. And you should ask any questions you might have. It will be your decision if you want to start PrEP. Some blood tests will be done prior to make sure you are HIV negative and your kidneys are working very well. Some people can start PrEP the same day and they can be given PrEP for 1 month.
It will take 7 days before PrEP is starting to work fully. When you come back after 1 month, your next appointment will be after 2 months, and after that every 3 months. During every appointment, an HIV test will be taken.
PrEP does not need to be used for life. If your level of HIV risk changes and you are interested in stopping PrEP, talk to your healthcare provider. So, if you want to learn more about PrEP or any other HIV prevention method, talk to us. PrEP is an exciting new way of preventing HIV infection. As with all new things, there is lots to discuss. Let's continue to talk about it, ask questions and get involved.